So embryo or fetal limit, 1/2 millisievert per month. Occupational limit for radiation workers, does not apply to patients. Is a monthly limit restricting the accumulated dose to approximately 5 millisieverts over the course of gestation. The previous limit was just 5 millisieverts for the entire gestational period, roughly 10 months, right? 9 to 10 months. But the new approach ensures that the whole amount is distributed so that it cannot be received in just 1 month's time. So just 0.5 millisievert per month. How do we measure this, right? So we wear a badge, all of us wear a badge right at our lapel, right about the thyroid level, okay? But in practice for this, the fetal dose is extrapolated from measurements taken by a second radiation monitor. The second radiation monitor is worn at the waist level by the worker. So it's right where the fetus would be. Now the badge companies know what the badge receives, and they can from that extrapolate what the fetus would receive. The fetus is not going to receive as much as the badge receives. Why do you think that is?
It doesn't penetrate all the way through.
Yeah. What's in the way of the X-ray beam, between the X-ray beam and the fetus? Mama, right? Mama's in the way, so abdomen's in the way, the uterus is in the way, fluid, right, is in the way, and so it's estimated, but it's done more accurately, but estimated, roughly the fetal dose is about 1/3 of the skin dose. So whatever hits the badge, the fetus gets about 1/3 of that. Okay. Yeah, so then just finishing this up, the student note, under 18 years is not occupational, but targeted, for example, at things like physics and chemistry labs, and the emergency limit for rescue workers treating or extracting victims from life-threatening situations, and it's intended to be once in a lifetime. Okay. Yeah.
So would they wear one right here and then one by the waist, or just the one by
the pregnant
waist?
worker? They wear both. Yeah.
Both.
So they're still measuring their own occupational dose, and they're wearing a second badge to measure fetal dose. Yeah. So both things are measured. Yeah. She can also, and I think we spend some time on this with more information, but she can declare herself pregnant, and then she can be requested to be moved to a low radiation area. Like let's say she's a radiographer that works in cardiac catheterization, or she works in surgery, or she works doing fluoroscopy all day long. She can request to be transferred to an area of lower radiation exposure to keep her baby safe. Yeah, and then back when she's not pregnant anymore. Yep. Yeah, she has every right to do that, and the employer is supposed to work in like good faith to make sure that she's as safe as possible. Yeah. Okay. The public limit is for people living near radiation industry, just the public, right? So importantly, when they say there's a limit for the public, they do not mean patients. Patients are not public. Patients come from the public, but when they're in our office, we're giving them a dose on purpose. That's not monitored. It's not limited, right? Think about it like this. If a patient's dose was limited and they were at their limit, but a doctor says, well, I need to do this exam, I need to do this study to diagnose such and such disease, and the radiation safety officer says, no, you can't do this study. What if the patient dies because of that, right? They died not because of radiation exposure, they died because doctor couldn't diagnose their disease and treat it, because he couldn't do the study because the patient was at their limit. This is a reason why there are no patient limits. Physicians are the ones responsible, physicians and radiographers are the ones responsible for the safety of patients. So there is no such thing as a patient radiation limit. We just use it reasonably, and in some cases their radiation doses are tracked, but there is no limit in actual practice to the dose a patient can receive. Yeah, no dose equivalent limit for medical patients. Radiation procedures are ordered at the discretion of the referring physician. Patients have the right to refuse a procedure and have legal recourse through negligence and malpractice laws if something occurs, something bad happens. Patient, develops some cancer because of radiation exposure, right? There may be malpractice on the part of the physician, but the physician will likely be able to prove that, hard to prove where the cancer came from, for one. And secondly, the physician can probably prove that they did everything within their standards of practice, right? It's at the discretion of the physician, the use of radiation. Once the physician decides radiation should be used to diagnose something, it's the radiographer's job to use the radiation safely. Okay. Those limits that you were given are what are called dose equivalent limits, but there's more to it. These are called whole body dose equivalent limits. Okay? That might imply that there is something called partial body dose equivalent limits. Okay, so you have a limit what your whole body can receive in a year's time, and in a lifetime or in a quarter. Then you, on top of that, have a dose equivalent limit for what's called partial body dose. For example, your whole body in a year is allowed 50 millisieverts. The lens of your eye is allowed 150 millisieverts per year. Bone marrow, breast, lungs, gonads, skin, hands, forearms, all of those structures allowed 500 millisieverts per year. Now you may go, well, I thought the gonads were really sensitive. Why is their dose equivalent limit 10 times higher than the whole body limit? Okay, that's a good question to ask. The reason why these numbers are so much higher is because whole body, a little bit to the whole body, is way more is going to happen from that than a lot to a small area. Okay, because these areas are so small, the dose equivalent limits can be higher. So partial body dose equivalent limits are higher than whole body because a small portion of the body is being exposed. However, the lens of the eye is still very radiosensitive. The gonads are still very radiosensitive. The hands and so forth, very radiosensitive. But importantly, these numbers are higher than the whole body doses are. Okay. And that, thankfully, is all of the dose equivalent limits that we have to remember. Okay. Now there's a few in there, but that's it. Okay. So the last note on this dose equivalent limit thing, and then we'll move on. Dose equivalent limits, DELs, provide guidelines to follow so that we can provide corrective action. Importantly, they do not constitute acceptable levels of radiation, right? It's not like a speed limit where we say your dose equivalent limit is 50, keep it at 50, right? So like, dose equivalent, the speed on the freeway is 65, right? You pretty much have to travel 65. They don't say like go anywhere under 65. They say pretty much travel at 65. In this case, we're saying it's a maximum. Try not to get anywhere near it. It's not acceptable to be at those levels. And corrective action would have to happen if you went above these levels. So stay below them and stay as far below them as you can. That's what's important here. They do not constitute acceptable levels of radiation. That implies that these are unacceptable levels of radiation if you get near them. And of course, the ALARA principle ethically supersedes any dose equivalent limit, right? Alara says keep the dose as low as reasonably achievable. That means to the patients, to the personnel, you, and to the public. Keep it as low as achievable at all times. That ethical guideline is your guiding principle for keeping radiation doses where they should be. Okay, so that concludes the dose equivalent limit section, and we will move on now.